What are the medicines that are used in vertigo?
See, medicines are of two types. First is the symptom relieving drugs, which are called vestibular sedatives or anti-vertigo drugs. Their effect is only to camouflage the patient's symptom and give some amount of symptomatic relief. They have got no role whatsoever in curing the underlying disease. So that is one group. And the other group of medicines is the actual medicine to treat the underlying disease that is causing the symptom of vertigo. And that depends upon the cause of the vertigo.
What does one mean by the term anti-vertigo drugs?
The term anti-vertigo drugs means those medicines which camouflage or suppress the symptom of vertigo. So these are called anti-vertigo drugs. They are also called vestibular sedatives. Their action is to sedate or make the sensitivity of the balance organs less. They desensitize the balance organ such that the patient does not feel so much of the spinning sensation. So this is the only purpose of these anti-vertigo drugs.
There are so many medicines available for the symptomatic treatment of vertigo, namely Vertin or betahistine, Stugeron or Cinnarizine, Stemetil or Prochlorperazine, Spinfree Dizitac, which is the combination of Cinnarizine and dimenhydrinate. Which is the most effective drug?
These are all anti-vertigo drugs. That means all the drugs that you mentioned just now, these are only to be used for symptomatic relief and they do not treat the underlying disorder that is causing the vertigo. Let's get that thing clear first. So, and of all these drugs, all of them come with a huge lot of negative effects. That means adverse effects or harmful effects. So, the doctor has to be very, very discerning when choosing the anti-vertigo drug. Effective one for immediate relief would be either prochlorperazine or the combination of cinnarizine and dimenhydrinate. Betahistine does not give good immediate relief. So it is not a medicine for acute vertigo.
How long can these anti-vertigo drugs be used?
To be true, these anti-vertigo drugs are to be avoided as much as practicable. Even if they are used, they are not to be used for more than 1 or 2 doses. That is all. Why? I'll come to that later on. But if the drug is at all being used, then the drug can be used for say a maximum of 3 days, definitely not more than that. Ideally, we never prescribe these drugs for more than a single dose or 1 or 2 days at the most. The reason why we do not use these drugs for more than 1 or 2 days is that they actually jeopardize the vestibular compensatory mechanism, which is nature's way of restoring balance after a balance system has been damaged. So that is why we do not want to use these drugs at all. And as I said, all these drugs have got tremendous adverse effects, side effects, and they actually do more harm than good. If the patient is having imbalance or unsteadiness or dizziness, then these drugs do not have any role whatsoever. Because these drugs, as I told you, is to sedate the balance organ. Now, somebody who is having unsteadiness, if that patient is given some medicine which will further reduce the sensitivity of the balance system, then the patient will be more liable to fall down, which is not something which the doctor would ever want. So, these drugs, these anti-vertigo drugs, can be used only for 1 or 2 doses, maximum for 1 or 2 days, never more than 3 days, and that is only and wholly and solely for patients who are having acute head spinning, not for any other reason.
If at all they are used, when should they be prescribed?
As I said, only during the phase of severe acute head spinning, not otherwise. That means, as we said, that the definition of vertigo is either internal head spinning or external head spinning. So only when there is head spinning, then these anti-vertigo drugs have some use. In a case of dizziness, in a case of unsteadiness, in a case of sinking sensation or blackouts, these medicines are never ever to be used.
The commonest sold drug for vertigo is a chemical called betahistine, which is marketed in different names like Vertin, Verbet, Be Still, Betloid, Vertistar, and many more. From the pharmacological point of view, how effective is this drug?
This is again a very controversial answer, but then let us get things clear. Though this is the highest selling drug in countries like India, this drug beta histine is not approved by the FDA in US. That means this drug is not allowed to be sold in the United States and in some other places also. Let's have this thing clear first. So, why is this drug not allowed to be sold? Because it has been shown that this drug is ineffective in the treatment of the disease for which it is meant to be used. So that is one. Moreover, different studies throughout the world have shown that the effect of beta histine is nothing more than that of a placebo. It does not have any medical effect much. There are numerous reasons for it. One is that the drug has got an extremely high fast pass effect, which means the drug gets destroyed in the gastrointestinal system after oral consumption before it even reaches the site of action. So that is one reason. Second reason is that studies have shown that it is not effective at all. And that it is comparable to a placebo, and other than a placebo effect, does not have any effect whatsoever. Then other issues are that this drug, when it was invented, different studies throughout the world had been done, and the scientists who had worked on it, they had shown that this drug beta histine is a drug which sedates the vestibular labyrinth and the balance system. This is a vestibular sedative. It reduces the action in the vestibular nuclei, the vestibular labyrinth, etc., and it sedates the balance organ. No anti-vertigo drug or vestibular sedative should ever be used for more than 2 to 3 days. This drug is now being marketed as a vestibular stimulant. This is unethical, and I don't think this is something which doctors should at all support, but then it is up to the individual doctor's choice and prerogative. The doctor has to take his own decision, but scientifically, definitely no.
What about cinnarizine or its combination with dimenhydrinate?
Cinnarizine, as I said, is also an anti-vertigo drug. That means it sedates the vestibular labyrinth, number one. And number two is that, like beta histine, cinnarizine is also a medicine which is not approved for sale in US and in some countries. So it is not a FDA approved drug. Let's have this in clear first. Secondly, cinnarizine induces too many side effects. Some neurological effects and some other different types of effects in the body. Now the adverse effects are more than the little bit of benefit that this drug can actually provide. Moreover, cinnarizine is known to induce Parkinsonism. So there are many reasons. So this is not a right drug, and that is the reason why cinnarizine is not approved for sale in US and in many other places. So its combination with dimenhydrinate is available, which gives good symptomatic relief. So I believe if a combination of cinnarizine and dimenhydrinate is used for 1 or 2 doses, or say a maximum of 1 to 3 days, then not much harm is done, and the patient can get some amount of relief from the acute head spinning.
Do these anti-vertigo drugs have any curative effects at all, or they are effective in only temporarily camouflaging the symptom of vertigo?
They do not have any curative role whatsoever. Let's get this thing very clear. All these anti-vertigo drugs, beta histine, cinnarizine, dimenhydrinate, metlizine, prochlorperazine, these drugs do not cure the underlying disorder that is causing the vertigo. So these drugs do not have any curative role whatsoever. They are only effective in giving some amount of temporary relief to the patient from the acute head spinning, which is of course distressing to the patient. But if these drugs are used for longer periods, they induce a lot of harm, and hence these drugs are best avoided altogether, and if they are to be used, they are never to be used for more than 1 or 2 days, preferably for 1 or 2 doses only.
Are these drugs just like using paracetamol in malaria or in pneumonia or in typhoid?
Exactly. Like if the patient has come to you with malaria, with fever, which is due to malaria or due to typhoid, you can never cure the malaria or the typhoid by giving the patient some paracetamol. It will reduce the patient's fever temporarily. So to treat the malaria or the typhoid or the pneumonia or the cause of the fever, you will have to first identify what is the disease that is causing the fever, and then treat that disease. Like for all patients of vertigo or balance disorders, the first thing to do is to find out the underlying disease that is causing the symptom of vertigo, and only then treat the underlying disease. In the first few hours, when the patient's symptom is too much and the patient is vomiting, patient is having unbearable symptoms, then 1 or 2 doses of these anti-vertigo drugs can be given, never ever more than that.
What are the constraints of using these anti-vertigo drugs for a long time?
First of all, as we said, all these drugs have got tremendous adverse effects. We do not have the time to go into the tremendous amount of adverse effects of these drugs over here. But all these drugs cause a lot of harm to the body. That is number one. And number two is that most of these drugs decrease the sensitivity of the central nervous system, and they are called CNS suppressants. That means they sedate the central nervous system, and when that happens, the patient feels sleepy and drowsy and the central nervous system gets subdued. And when that happens, the vestibular compensatory mechanism, which is nature's gift to humans to restore balance naturally after the disease has destroyed a part of the balance system, that gets jeopardized. So all of us have in our central nervous system in the brain a mechanism which is called vestibular compensatory mechanism. The function of this vestibular compensatory mechanism is to restore balance after the disease has destroyed a part of the balance system. So because balance is a very very sensitive organ by which we can survive, so for that nature has given us a second line of defense, so that if the balance organ of one side gets damaged, then the central nervous system in the brain can restore balance even though that part of the balance organ is diseased. And that mechanism by which the balance is restored to normalcy by itself is known as the vestibular compensatory mechanism. Now when we give these drugs for some time, then this vestibular compensatory mechanism gets jeopardized. Why did I say that these drugs are to be given, are to be avoided first of all, and if given, they are to be given for only 1 or 2 doses? The reason is that the best part of the vestibular compensatory mechanism takes place in the first few hours after the damage to the balance system, and if in that time we are sedating the central nervous system or the brain, then the mechanism of the vestibular compensatory mechanism will get completely jeopardized. So that will get destroyed, and the patient will remain imbalanced for a very very long time, maybe permanently, and that is not what we would want. So that is why these drugs are to be avoided, and if given, they are to be used for 1 or 2 days, never ever for more than that.
It is ridiculous that the same anti-vertigo drugs of the same strength is sold at different prices by different companies. Multinational companies sell a drug like 24 mg of betahistine at rupees 31, whereas some other companies would sell the same product at a much lower price, rupees 11 or rupees 13, and some at prices of rupees 20 or rupees 25. This means that for a medicine which can be sold at rupees 11 or rupees 12, patients are being made to pay 2 or 3 times the amount, which is very unfair and tantamount to deceiving naive patients and taking patients for a ride, capitalizing on the patient's ignorance. 1. Are the patients being fooled and taken for a ride? And 2. Why doesn't the patient get a standard product with all purity and efficacy parameters at the least payable price?
Exactly. You have hit the nail at the right place. That is exactly what is happening, and our patients need some amount of awareness and education such that this tomfoolery and this nonsense is brought to a stop. This should not be allowed to continue in a poor country like India. This has to stop. You see, the point is, as you very rightly said and must have found out from the market sources, that the same medicine is sold at 31 rupees by one company, and the same medicine is sold by another equally famous multinational company maybe at 11 rupees. The chemical composition is the same. So this is ridiculous. Why should a patient pay 31 rupees for a medicine which is available at 11 rupees only. And let me also tell you that if the generic brand is purchased from the market, from this John Oshadhalaya or any of these things, then the same beta-histine tablet of the same 24 milligrams is available at less than 3 rupees 50 paisa. So that means something which is available at 3 rupees 50 paisa is being sold at 31 rupees plus, more than 31 rupees, and our poor people are having to buy that medicine at such a high price. And these medicines, they are given say about 3 times a daily. So that means if the patient is taking 24 milligram of beta-histine thrice daily, if he uses the costly brand, then the patient is spending say 92 rupees or 95 rupees. But if he had bought the medicine from some generic store or from say John Oshadhalaya, he would have spent not more than 10 rupees. So every day the patient is losing more than 80 rupees. If this continues for more than 15 days, so do you estimate how much the patient has lost? And where did that money go? That money has been spent either for unholy reasons, or the companies have made huge profits at the cost of our poor patients. So our patients need more awareness, and doctors should also try and prescribe only the generic names, such that when the patient goes to the shop and says that I want beta-histine, the shopkeeper will tell him that yes, beta-histine is available at 11 rupees, at 15 rupees, at 31 rupees, which one do you want to buy? If the patient opts for the 31 rupees, the patient can buy that. If the patient opts for an 11 rupees brand, the patient can buy that. Chemically, there is no difference between that 11 rupees brand and the 31 rupees brand. And that is the government's job, to ensure that any medicine of the same strength, of the same composition, which is sold at a lesser price, is not chemically or biologically inferior than the costliest brand. That is the government's prerogative. The government has got mechanisms to look after that. So we should not think that a medicine which is sold at 11 rupees is in any way lesser potent or has got lesser bioavailability than the same brand of the same medicine which is sold at 3 times the price. So this is something about which public awareness has to be created.
The irony is that most costliest brands usually have their highest market share. Does that mean that naive patients are being fooled and taken for a ride because of some holy nexus between different stakeholders?
It's difficult to hide the truth. The answer to your question is, I would say yes. This is not what it should happen, but that is what is happening. You see, I do not understand why this is happening. The costliest brand of the same chemical, of this having the same pharmacological ingredient, which is the costliest in the market, that has the highest market share. That means doctors are prescribing it. So if the doctor is made aware, see, many times the doctor does not know that the same brand is available at much cheaper prices also, because the pharmaceutical companies, they only go and meet doctors and say, you prescribe my drug. They do not ever say what is the price of the medicine. So many a time what happens that the doctor does not know that this medicine is available in 5 different rates, and this one is the costly brand and this one is the cheapest brand. There is no difference in the chemical composition and the bioavailability of the different brands. Get this thing clear. So all are of the same potency and of the same efficacy. There is no way by which you will be able to show that one made by, which is sold at say 11 rupees or 13 rupees, is in any way inferior than the one that is sold at 31 rupees. So that is not there. But if the doctor does not know that these different varieties are available at different prices, then the doctor only prescribes the one which is most advertised. And which one will be most advertised? Which one is the costliest? Because the company that is selling the costliest brand, they will have much deeper pockets and they will advertise much more, and so those are the ones that are being sold. So it would be very nice if our government could introduce this system of prescribing medicines by their generic names. That means the doctor does not write the brand of the brand of the medicine, but write the chemical name, that is the generic name of the medicine, not the brand name. Then this is something I think about which public awareness has to be created, and whenever a patient is prescribed any drug, the patient should always ask the doctor or the medicine shop, the chemist, that can I have another brand of this same medicine which is cheaper than the one that the doctor has prescribed to me. So that would be much more helpful. See, against this you can say that the costliest brands are more effective. There is no proof of it. How will you prove that the costliest brand is the most effective? Maybe that the ones which are sold from the John Oshadhalaya are not I am not too sure whether they are of any less efficacy or not. I don't think they should not be of any less efficacy. But I do not know about it. But another one which is sold by another equally well-known multinational company, why should that one be inferior than another one which is costly? And why should it be so that the highest amount of market share is by the company that is selling the costliest brand? You see, this is something which is not acceptable. And this can only be stopped if public awareness is created. The patients will have to be careful about these things.
This video has been made to create public awareness and to educate patients on some basic medical issues related to balance disorders. Information provided is on the basis of personal experiences and knowledge of Dr. Anirban Biswas, gathered over 40 years of medical practice. Viewers are hereby instructed to verify and authenticate the information provided by the patients, consulting detailed medical texts, and by discussions with their personal physicians. In all the matters, the opinion of the physician treating the patient is final, and the patients are to follow that advice only, be it treatment or diagnostic tests. There is no intention to hurt or modify the business prospects of any organization, be it a pharmaceutical company or a medical institution or a medical instrument manufacturer. The purpose of this endeavor is to promote ethical and scientific medical practice and to allow patients make an informed decision congenial to their best interests.